Okay, we're meeting today just because there have been some med airs that have been done, actually too many of them. So when that happens, you have to meet with the nurses again. And we have to go over our policies and procedures for medications. And we're going to go over also the narcotic policy, the NARC book, and also when you should call the nurse. We're going to do a wound treatment demo. So any of you that have not had the wound treatment demonstration, we will have you do that demonstration. I got the wound dummy with me. And we're going to do an overview of tube feeding also, because there was some things brought to our attention that were done incorrectly when it came to doing a tube feeding. I'm going to start with the tube feeding. Olivia is our only tube feeder. We need to make sure that we burp by putting her tube on and just opening it up, releases the excess air. On the MAR, it states to give 50 cc's of water first. Then she takes, was it 4 meds in the morning, Melissa? 4 meds in the morning. So you should have 4 cups that have 10 cc's of water. That also states on the MAR. So that when you do 50 cc's of water first, then you do a med, then you do 10 cc's, then a med, 10 cc's. And then you do that last 10 cc flush. You give her feeding, and then the remainder of her flush. I have it all calculated for you. I've done the math, so you don't have to worry about doing the math. So for the amount of fluid she gets per feeding. Any questions on that from any of you? Got it all? Okay. Just a reminder, she has her one feeding with the fiber. She gets that half a can at 2 o'clock. Always check that little fridge to make sure.
3 o'clock.
Or 3 o'clock. Make sure that it's in there, if there's one in there, because you can take that out, give it 30 minutes to warm up to room temperature, and you can use that.
We run out of that one sometimes because they are planning that we are using that half bottle all the time.
Mm-hmm.
So it's closed.
Right, so if people don't use it, it's only good 24 hours after it's been opened, then it gets thrown. So that's why we'd run out of feeding.
We should be pretty good though, because
it's happened, I think, a couple times.
We have one person that does meds about 80 to 90% of the time, so she knows.
I know, it's only happened a couple times.
Yeah, right.
That people have done that, so.
Sure.
And it wasn't that staff person.
Yeah.
So, medication administration. We need people to make sure that you read the label on the meds. Look at the MAR. That label should match the MAR. If it does not match, you need to the first thing you should do is what?
Check the order in their books.
You would call the nurse regarding it because they're not matching, okay? If you would call nursing, we would then say, we would look up for you. We would then say, please put a direction order change on the label. And what's in the MAR is the correct dose, give as directed, okay? What some of the meds were is we had people that were getting Senecot twice, 2 of them a day, and they had a single one in each hole. So staff were just punching out 1 because the time before the car had 2 in each bubble spot. So staff just don't get complacent, so to speak. Just remember, always read, always check, count your pills once you've punched everything in your cup. That's the sure way of not making a med air, okay? If you count how many you've got here and you count your here, you know you got all your meds, okay? Make sure you put all your meds in separate containers. Put your liquids in a separate container versus your pills or your powders, okay?
Your pills probably all go in the same spot,
Yep.
but don't mix the pills with the powders with the liquids. They should be separated.
Okay, so if you have somebody that takes Miralax in applesauce, okay, and they take their meds in applesauce, Once you've got everything all done, then you can mix it all up into your concoction when you're going to deliver the medication and administer it, okay? Because what happened was someone had put a Colace, put the Marilex on top, and then it was put into a cup, and the client was drinking, and they're like, there's a pill floating in my cup. Okay, so.
And that person isn't here, so it's
No.
not really a good.
Well,
It's funny. It's funny that some of the stuff that it regards the people aren't here.
They
I'm
get to watch
one of
the
them
video.
though, so
they will get to watch the video.
yeah, can
They
you-
get the fun video and they will get no candy.
The other thing is, Melissa and I are going to go over. I'll let you do when to call the nurse. I'm going to go over the narcotic policy. So go ahead, Melissa. I'll let you go for the nurse.
Well, we have actual, of course, Phoenix has actual policies on everything. So one of the policies we have is when to call a nurse. And this is the kind of thing that's kind of reviewed during NEO, and I don't know if it's ever necessarily touched on again. Generally, the staff know when they're supposed to call the nurse. It's reiterated, but we thought that we should just go over it. In regards to seizure, anything that is abnormal for a person, if Laura's having a different type of seizure than she's already ever had, you would call the nurse. Always document the seizures. Anytime that there's a resident that has never had seizures, you would call the nurse. Anytime there's repetitive seizures, if you have to give the PRN, if you give the PRN and the person is not responding to the PRN. So in that case, you would follow the protocol, and then when it stipulates call the nurse, that's when you call the nurse. Anytime somebody is injured, the incident report needs to be filled out, the nurse needs to be called, the supervisor needs to be called. If there's bruises, abrasions, injuries, sometimes they need to be called in, and sometimes we can just document them as a minor incident, but it's typically the nurse and the program managers that guide how that's going to happen. Anytime an individual falls, you do not get them off the floor. There are some individuals who get themselves up off the floors. That doesn't mean force them to the floor. But before you get them up, I would call the nurse, and it's going to be under the nurse's direction that you get them up. And then that way, both the staff and the client are covered medically. Anytime there's unexplained bruising, bleeding that you can't stop within 10 minutes, burns including a sunburn, large abrasions or cuts, or when there's swelling or possible injuries to bones, any kind of skin issues, rashes, red areas, tears, breakdowns, especially on them bony prominences, and that's kind of prevalent in this house. Anytime you have a new skin issue going on that has never been there, or if somebody has a cream and their acne flares up, call the nurse, they'll put it on the MAR. Anytime somebody has vitals that do not fall within the normal ranges, you would call. Or if there's vomiting or excessive diarrhea. Now, diarrhea is considered to be more than one loose stool. So don't just call for one loose stool. But